I'm Xander Aver Thomas, and this is my video assignment for dressing and wrapping a wound and kinesiology first aid. So before I begin treating the patient, first I can see where the wound is, where to stay. There is a laceration to the leg. If you don't mind pointing to it. So I can see the laceration. At this point, it is assumed that I have been given consent to treat the patient, but before I do begin treatment, I want to make sure that there's safety between me and the patient to ensure no disease or anything is transferred, to ensure infection can't spread. And for that, I've got black examination gloves. Now, before I can fully begin treating the wound, first I have to make sure that it stops bleeding. And for that, I've got some medical gauze here, which is kind of hard to open while I've got gloves. So I'm going to apply pressure directly to the wounded area until the bleeding stops. Now at this point, I can see the bleeding is mostly stopped. I'm going to dispose of this properly. And I'm going to clean it. Now this is 90% peroxide, but it is suggested you use an antibacterial soap or Bactine. I'm just working with what I've got. Now that the wound is clean, I'm going to take a non-stick gauze pad to wrap it using the circular method. So I'm going to first ensure that the gauze is secured. And I'm going to alternate my wrapping . And then once I'm done wrapping, I'm going to take some cloth tape and I'm going to secure the wrapping. And with that, the bandage is secure. And I'm going to dispose of all material and waste, including the gloves, which I will use the pinch method to safely remove. And I always double bag. All right. How'd you grade that?